All right, well, welcome everybody. We are going to be reviewing success strategies for MSK1. And my name is Dr. Thomas Eberly. I am the lead orthopedic faculty for this course on the Miami campus. I'm also one of the original co-creators of the course. So I've been teaching this course since we started the new curriculum, which started in Miami in 2016. So I am getting over a little cold, so I probably apologize for the voice. Usually volume isn't an issue for me, as you can ask anyone on Miami. So if you can't hear me, though, I can speak up or adjust my volume settings. How's the audio so far? Doug Becker. Great. All right. We have Victoria Faulkner on. We have Holly Hogan on, and then a bunch of others without their cameras. This is very informal, so if you don't want your cameras on, that's fine. I'm going to go over a brief discussion through about 5 or 6 slides, which I'll be sharing my screen, and then we'll break into questions and answers. That's the format for this. Great. Just give me one moment to share my screen. Okay, and again, this is success strategies for MSK1. This is the second semester we are doing it. We started it in the spring, and now we're going into the summer. All right, so the overview here, we have just 2 key objectives. We have identify content areas to prepare before and during MSK1 courses, and to identify strategies to promote success in the MSK1 course. Great. All right, my apologies for that again. I have a 2-year-old and she was watching Cocomelon. Anyway, let's continue here. Doug, I can see you. Can you still hear me okay? Okay, great.
Yes, sir. I hear you fine.
Excellent. Okay, so prepping for the MSK1 course. So you guys are all 4 weeks into the course, so you should have bought the 3 textbooks by now. So the 3 textbooks, again, is your primary orthopedic textbook, which is done by Dutton. And that's a pretty thick book. That can be intimidating. I want you to remember there's 5 orthopedic courses, 5. MSK 1, 2, 3, 4, and soft tissue 2 is the 5th orthopedic course. So please remember, you'll be going through all of that book through those 5 courses. So don't think you're going to digest that whole book just in one semester. Secondly, you have your Olson textbook, which is specific to the spine. And then you have your Cook textbook, which is your special test book. There are special tests in Dutton, but the Cook textbook is an excellent reference. Additionally, you should get your 3 seminar manuals. So I think you know St. Augustine has seminars, postgraduate seminars for physical therapists. So we teach these in the MSK 1, 2, and 3 course. These courses are E1, which stands for Extremity 1. And there is an Extremity 2 course that's available after you graduate or possibly as an elective. And then the second course is S1 or Spine 1, and that is taught in your MSK 3 course. Both E1 and S1 are taught as an introductory level in MSK 1. And then your MSK 2 course will dive deeper in the extremities, and as I stated, MSK 3 will dive deeper into the spine. Another thing you'd like to do is download and print your lab manual. Okay, this is essential. The lab manual goes over which techniques we're going to be covering from that E1 and S1 book. The E1 and S1 book is your primary technique manuals. Yes, there's techniques in your Dutton textbook, but the E1 and S1 manual is where we're going to do all our passive range of motion accessory. If we're in the spine, we'll call that PIVMs or passive intervertebral motion, or PAVMs, passive accessory motion. Okay, but basically when you're doing joint mobility testing, which is what all of this is, or if you turn that into a treatment, which is manipulation, that's all going to come from E1 and S1. The lab manual for MSK1 will go over which techniques we're going over. So for the shoulder, there's many techniques in that E1 book, but there's 3 that we do in MSK1, glenohumeral posterior glide, glenohumeral anterior glide, and glenohumeral inferior glide. So if you look at that lab manual, you know which 3 techniques to prep for. Instead of just digging through the whole thing, it could be a little overwhelming. And then just with all of your courses, okay, with all of your courses, there's no getting around the anatomy. You have to memorize it. My recommendation is draw it, When you can draw it, you know it. And usually I say it. So there's 3 domains of learning. You have your visual, your auditory, and your psychomotor. So when you're drawing it and speaking it, and you're obviously looking at it, that will pull in all 3 domains of your learning, and that will help solidify it into your long-term memory better. Okay. And then review your musculoskeletal pathologies from your previous coursework. And that might be other pathologies that are more medical, like cancers or osteoporosis, anything that will help you within your musculoskeletal course. That pathophys course you took first semester is a big course. And we do a review of that in week 4 because we received feedback after teaching this curriculum a couple semesters. And Miami led this curriculum, this new curriculum version that started in 2016. Miami led it. So after a couple semesters, the students were like, pathophys was just such a big course. We'd like a review of it somewhere. Because because MSK1 is a 4-credit course, we had room to add a unit to our course. So we took it on, and that's why you have MSK 1, you have in that unit for a review of pathologies. Okay. Now, the study habits for each unit. So what you want to do is you want to read the unit learning objectives on Blackboard. And there's an example of that right here on the lower area, unit learning objectives. So you want to look through those. I'd even write them down. If you're taking paper notes, if you're using some kind of electronic note, great, write them down. And make sure as you're going through your readings from Dutton and Olson and Cook and through all your Blackboard material, you're understanding and answering those questions. Okay? Okay. Now, I hope you don't mind. We're going to continue to do this with my baby girl here. So this is a good way to get her not to scream. So this is actually helping. All right. So the only time that we could get this for all 4 campuses, because we're going to California, was to do it at night. I'm on the East Coast, obviously Miami. So I do apologize, but you know, I appreciate your patience and understanding on this. Okay. So Blackboard unit objectives. Then you want to review all the Blackboard material. Every faculty lead has the ability to bias their assessments or quizzes and written exams to wherever they want. In Miami, I bias it more towards the Blackboard because the Blackboard material, orthopedics is such a huge area, right? So basically what you need to do is you need to be able to focus on a specific area, like even if it's just the shoulder, you need to be able to focus on what's going on at the shoulder in MSK1 for that unit. When we get to MSK2, you're going to be expected to know pretty much everything about the shoulder because it's more advanced. But just focus on Blackboard, but definitely talk to your lead and see how they pull the questions. If there's a certain percentage of questions they pull from the readings, for example, some professors might say, well, I'm going to pull 20% of the test questions not from Blackboard. I'm not saying they do that. I don't know. So you just need to talk to the lead faculty and see how they're going to assess you. And again, when you hear assessment, that's faculty speak for quizzes, exams, that kind of thing. And if there's anything on Blackboard that you're not sure about or want to know more information, you're definitely going to want to go to your textbooks for that. Okay? All right. Now, before each lab, you're going to, again, reference that lab manual and go over all the passive range of motion accessory or mobility tests. There's usually a couple of those. There's 3 in the glenohumeral area, by the way. There's 3 at the elbow. And then there's a bunch at the wrist and hand. But you also want to review the MSTTs or the muscle selective tissue tensions and the special tests. You want to do that before you get to lab, okay? Now, honestly, guys, this isn't a lot. I tell my students, you should prep for lab just at the minimum 15, 20 minutes. Just look at the pictures, see the setups, recognize the names, okay? Know the tissues they're being tested for. MSTT is always muscle tendon. The special tests are various tissues. The PROM accessory, know the open pack position. kind of get an idea. There's videos on Blackboard for a lot of these techniques, special tests and manipulations. And then when you get to lab, it's not the first time you're seeing it. And then you can understand and ask appropriate questions. Okay. So that will help you immensely. And I can't say that enough, is show up to lecture, show up to lab prepared. If you show up with doing the bare minimum, you're going to be lost. Because remember, you have all this information. So when you get to your lecture or your lab, your course lead is just supposed to not introduce material to you, but really go in more depth, go into some clinical definitions. The lab's a little harder because it's tough to look at a picture and know how to do it. So obviously those psychomotor techniques, we're going to just stay with the basics, and this is how you do it. Now practice. Okay, now practice with a different partner. Let's go back a unit and make sure you're still good with the shoulder if we're on the elbow, or if we're on the wrist, to go back to the elbow and the shoulder, that kind of thing. But for the lecture, I don't sit up there and read the PowerPoints. You guys have the PowerPoints. So your lead should be making that material vibrant for you and making it clinically relevant, which is, remember, in 3 short semesters, you're going to be out on an internship treating human beings. So you want to make sure that you're connecting the dots on why this matters. I talked about watching the videos. And if you want to practice the techniques beforehand, you can, but definitely you want to practice them after. And you want to practice these techniques daily, okay? You don't want to schedule a 2-hour, 3-hour, super Saturday where you're going and doing all ortho. Studies show it's better to do increments of 10, 15, 20 minutes a day. Do that consistently with practice, as opposed to just doing 2 to 3 hours at once. That's very important. And I can't stress this enough that, you're not going to see some of this material for another semester or 2 before you go out on an internship. MSK2 is not going to go back through everything we did. They're going to go forward. So if you exit MSK1 and this stuff isn't really cemented in your long-term motor memory, when you get to internship, you're not going to be there. And I think we all would agree, we don't want an intern working on us if they're not proficient in the skill, right? And that's one of the reasons we have lab proficiency set at 80%, because, think about it. If you showed up for any healthcare worker that's doing anything on you, do you want them to be a C average in their abilities? I don't. I want someone that knows what they're doing and has, in our profession, the hands and the knowledge and the exercise. 3 written exams through the semester, and then we have a final comprehensive exam. So I believe all the campuses are doing a final comprehensive exam. So you need to remember your unit 1 through 4.
Hey,
yes,
sir,
Doug.
You keep cutting out. I don't know if we can do something about that.
Could I review anything that you possibly got cut out on?
It was like at the very end of the last slide you cut out, and then when you came back, you were on this one. So I don't know if I really missed anything.
Let me see.
You're just talking about the internships and why it's important to make sure we know it before we get out there, and then you kind of cut out right there.
Yeah, I was saying you're not going to touch this material for a few semesters. So you have to leave MSK1 being proficient in the skills, because you're not going to practice everything at the end of MSK2.
Okay.
Okay. Great. I have a device here I'll shut down. That might help. Okay. Great. So onto this slide again, just practice, both in the lab and the lecture material. You want to, stick with it 10 to 15 minutes a day. I'm a realist. I know that ortho, even though I'm an ortho snob, and I freely admit that, I know that's not your only course. And some of you might not even want to do ortho. So I just want to review with you that I knew I didn't want to do neuro or peds. I use neuro and peds in my practice. Okay. So even if you're not gung-ho about a certain area, just know in DPT school, we have to silo it in different classes just to organize it. But when you get out in the clinic, you use everything. Okay. So you will use stuff from ortho in your other areas. You will use neuro and peds in your ortho. So pay attention to all your courses and take them all seriously. I would recommend this for all your classes, by the way. If you have a 1-credit lab, like Applied 1 or Applied 2, it's less content. So, you may not have to do as much of it, just maybe 5 to 10 minutes a day, because there's just less material. On other courses that are more lab heavy, you might have to take that to 15 to 20 minutes. Okay. But the point is you have to, and then there's the other factor is how well do you pick stuff up? If you're really a natural at a certain lab, excuse me, if you're really natural at a certain lab and you're just picking up the material and it all makes sense for you in a certain course, then you have to practice it less. But if you're struggling, then you have to practice more. So it really comes down to your individual natural abilities. Okay. In MSK1, all the campuses do these case study assignments weekly. Put time into them. Some instructors grade some of them, some all of them. I don't typically grade them because I don't want them to be a penalty, but I do remind my students that on their exams, they have to do a case. So if they blow off the cases, it will catch up with them on the exam. I don't like to penalize my students with grading it weekly because it should be more learning. That's my philosophy. Other professors might have a different philosophy. That's fine. There's always more than one way to do something. So, but the point is, whether it's graded or not, put the time in, okay? I tell my students this all the time. MSK1 is a critical thinking class on a backdrop of orthopedics. It's really about critical thinking. It's not about having the right answer. It's about how you got there. So you need to understand the process and the process of thinking, because that's how the PT clinic works. Your patients don't come in with a multiple choice on their shoulder saying, A, I have supraspinatus tendonitis, B, I have a labral tear, or C, I have something else. So you want to be able to understand and think about it. Okay, so now participate in class. Ask questions, show up prepared and ask questions, because basically if you just don't understand something and don't use your class time, you are going to have issues. Okay, honey. The last thing is that you want to utilize the instructor's time. As far as their time for their meeting time. So go ahead and use their meeting time. All right. So again, what questions do you guys have for me? If any.
I guess MSK, I guess it's hard course for everybody, I assume. But coming from a criminal justice background, do you have any advice to play catch up? Because I feel like not having a exercise science, kinesiology, any of those type of undergrads kind of puts me behind. And so I really do feel like I'm playing catch up.
Yeah, Doug, I hear you. So no matter what the background, there are the prerequisites, but I agree, like you may not have had as many electives, or, if we have like athletic trainers, for example, they've already treated real patients as an athletic trainer through their curriculum. So my advice to you is take the anatomy book and draw out, and I mean it, draw out each section until you know the anatomy. You need to know the muscle actions and where they originate and insert. And the reason that's important is if you remember muscles pull, they don't push. If you know that the ankle, for example, everts, well, if muscles pulled, those muscles have to be on the outside of the foot. Now you know it's the peroneals. So it'll help you with the muscle action if you know where they are. The posterior tib's on the medial side of the ankle, so it's got to do inversion. Okay? The posterior tib's also posterior to the medial malleolus, so it's got to do plantar flexion, not dorsiflexion. Okay? The anterior tib muscle comes down the front, so that makes it a dorsiflexor because muscles pull, they don't push. But it attaches on the navicular on the medial side, So that means when it comes up, it's also got to go up like that. So now you know anterior tib is a dorsiflexor and an inverter. So those are just a little couple tricks to make it easier, because you're going to have thousands and thousands of data points that you're trying to remember in PT school. So any shortcut you can make will help you. And there's no shortcuts to anatomy. You just have to memorize it. But if you have that down, that will be a shortcut to a lot of other things.
Okay. I appreciate it. I feel like the anatomy is my one strong suit.
Good. So that will help you a lot.
Okay. I appreciate that.
Yep. And then you look like you work out a little bit. I mean, just having an exercise background, the exercise will come natural. In MSK1, at the end of Unit 3, we went over specific dosaging. When you go to the gym, it's mostly cardio. And then, usually if people are working strength, there's 3 sets of 5, 3 sets of 10. So a lot of times our patients aren't ready for that because of the pain they're having and their arthrokinematics are off. So we got to start them out at like, it's week 4, so I'm sure y'all have this by now. So you got to start them off at 3 sets of 25, work on the coordination endurance, or if they have a lot of pain and guarding and swelling or edema in the area, inflammation in the area, you got to even go lower than that, and something they can do 30, 40, 50 reps or more where they're not fatiguing. And that will help a lot. When I graduated from PT school 20 years ago, we did 3 sets of 10 for everything. And if it was fancy, it was 3 sets of 15. And there was no real scientific reason why we did one or the other, and then everything else was a cardio. So it was really 2 options. It was 3 sets of 10 or do cardio. So appreciate your exercise dosage. It is amazing. It's amazing when you can dose exercise for a ligament. It is amazing when you can dose an exercise tissue healing for cartilage. We have that ability. But you do have to understand it, and you have to be able to communicate that to other providers because no one else knows this stuff but us. They don't. Nobody gets exercise training like we do. Nobody. We're the movement specialists, so we got to own the exercise piece. And honestly, if I'm being honest, that's like one of the biggest areas we can improve upon in the profession is when you guys go out on your internships, all of you have volunteered in clinics. If you've been in outpatient clinics, hopefully you saw something more than 3 sets of 10. Or if we're feeling fancy, 3 sets of 15.
I do have a question in regards to like the Blackboard content material. So I feel like, and this is just kind of coming from the St. Augustine campus standpoint, that preparing for like the first few units where it's all like the understanding of the basics moving forward, as far as the content that's there, I feel like I can get the generalized content that is there as far as like what a tissue specific impairment is, like, tissue reactivity, subject reactivity, so on and so forth. But I feel like where I struggled personally in our first exam was how to apply that content to a more specific type of question, because I was able to answer it in regards to like, I knew what the content it was that it was talking about. And I knew like, if you were to ask me, okay, what is tissue reactivity? What is subject reactivity? I could explain it, but I guess I struggled with knowing what that means and applying it to like answering. Right. That makes sense.
It does. It makes perfect sense. And we have the rest of the semester to do all that. Unit 1, 2, 3, there's really not 4 is a review unit on pathologies, right? And just taking unit 1, 2, 3 and applying it to a case. So now we're going to take unit 1, 2, and 3 and apply it to the shoulder in week 5 and the elbow in week 6, and then so on and so forth, all through the body. So, I tell my students, double up your studying on unit 1, 2, and 3, like really go hard. If you put the work in now, it's like investing. You put the work in, you dump the money in when you're in your 20s, by your 50s, you're going to be set. If you put the money, so to speak with the metaphor, if you put the money in unit 1, 2, and 3 and really hit that hard and understand it, when we get to the shoulder, it's going to be like, oh yeah, I already know 1, 2, and 3. I'm just applying it to the glenohumeral joint or the radiohumeral joint at the elbow or, whatever it is. So you'll be much further ahead of the game. So if you feel like right now you're a little weak with unit 1, 2, and 3, definitely go back through those units. I mean, units 1 and 3 are huge. 2 is kind of a small baby unit, but we had to cut it up somehow, and it just made sense. Exam's a big piece, and then we cut up the management between unit 2 and unit 3. If you're still, and we do have those cases to help solidify that material from unit 1, 2, and 3 and make it real. You'll know that the cases were developed by clinical faculty like myself. So those are taken from like real patient cases with the names changed and all that, or just, oh, I remember this patient from 10 years ago. Let's mix it with this other patient over here. So it's not, the cases you have will be very relevant to what you'll see out in the clinic. You'll notice like there's not just one thing wrong with the people. Most people don't come in with one thing. They come in with multiple things. And you have to piece all that together during your eval. And that's what the cases are for. Great.
Thank you. I appreciate that.
Yep. Well, it is MSK1 and it is an introductory class. So I would honestly just, I would talk to them about it. And if that doesn't go anywhere and the class as a whole wants to at least see an example, especially if you have a video of it, because a lot of the special tests there's videos of, but not all of them. So if there's a special test there's no video for, ask him to show it. Because there's multiple ways to do the test. I mean, you could go on YouTube and look at it, but you might get 3 different ways on how you're going to do the test. So I would definitely ask him to show the ones that aren't on the Blackboard. If it's on Blackboard, then, for him to re-show it in class, I can see his point on that. But for the MSTTs, I would ask him to critique you on how you're doing them, because you're not necessarily going to see those in textbooks, because that's kind of a University of St. Augustine thing. And while there are pictures in the book for certain MSTTs, there's not pictures in the book for all of them. So I would encourage you to get feedback from your lab instructors on if you're doing it correctly or not.
Go over some of that stuff in class with us, and then maybe talk to my classmates before that and see. I like to think I'm not the only one that feels that way, but I could be.
Yeah.
So.
And even if you're the only one, everybody has different learning styles. So I would pull either Dr. Doherty over or somebody else and say, hey, have it all set up and say, hey, did that look right? Or what could I do better? Or what could I do worse? As opposed to just, oh, show me the technique. He might be taking that as you didn't do your homework. So at least if you've gotten part of the way there, hopefully he will critique what you're doing right and what you could improve upon. So that's another way to approach it. I know Dr. Doherty fairly well, and he wants to make one of the reasons he uses this technique is he wants students to show up prepared to his labs and do their homework. So, and that's actually a very positive, every way you do things is positives and negatives, So, so if you call him over while you have the technique set up and you're physically doing the technique, I'm sure he'll be a lot more open to critiquing that, as opposed if his perception is he's just spoon feeding you something and you didn't do your homework and prepare.
Okay.
That's just advice for that specific situation. Yep.
Okay, great. Thank you.
Yep, absolutely. All right. Well, I'm going to put my email in the chat here. And of course, your lead faculty is always where you start with questions. But if you have anything random, I'm a private practice owner in Fort Lauderdale here, and I'm also president of the FPTA. So if you have anything on practice or advocacy, if you have anything on what's going on in the state or at the national level, I'm a good contact for that. And just if you want to talk shop about certain clinical cases or that kind of thing. Again, if it's something to do with the course, obviously go to your lead or one of the assistants, depending on how your course is set up. Okay. With that, I wish you all a great night. Again, for those that were on earlier, I do apologize for my daughter. I hope that meeting wasn't annoying or anything, but it's just the realities of being having a young daughter on. My wife's a graduate of St. Augustine, and she's a physical therapist, and she was working late tonight. So she works at an outpatient clinic in Boca Raton. So anyway, with that, have a great night, everybody.
Thank you, Dr. Albing.
Thank you.